Loneliness is the latest epidemic, and research shows that its impact is as deadly as smoking 15 cigarettes a day. The quality of people's relationships is the single clearest predictor of physical health and quality of life. But people on the South Side are being separated from their neighborhoods when new businesses move in and prices go up, and some people have to move. While we can't bring back family and friends, we can fill the gap in human connection for these minority communities. About 1 million African Americans lived in Chicago 15 years ago, and since then, nearly 200,000 African Americans have moved out. This is a map of the community areas in Chicago in the 1980s. This is Hyde Park, number 41, and that's where we currently are. As you can see, in 1980, Hyde Park was over 60% black, and today, Hyde Park is only 30% black. Meanwhile, throughout the years, housing prices in Hyde Park have steadily been increasing, and it's gone up by 3% in just this past year. Hyde Park is a good example of a neighborhood that has been gentrified, meaning that rent prices have gone up and people, usually racial minorities, cannot afford to keep living in that neighborhood. I did some research with a community-based organization over the summer called Greater Auburn Gresham Development Corporation. My team and I were collecting data and researching some ways to prevent negative effects of gentrification in Southside communities. I ended up surveying about 40 residents and asking what they thought defined their communities. Residents overwhelmingly said that people that lived in communities defined their communities. While they want improvements, they also want to be able to enjoy those improvements with the people that they care about. One of the interviews I did was with the owner of a small business. He was a hairdresser, and I asked him about what changes he wanted to make in his community and what he hoped to see in the future. He said that he wouldn't have a problem if big businesses came to the community because they tend to bring more opportunities for jobs and products and things that people can have the opportunity to buy. But he said that he wished that the people who started these businesses were actually community members themselves. And this is because people who live in communities for a long period of time will have that community's best interests at heart and will ultimately want to help the community in the long run with whatever business they're starting. Whereas with bigger corporations that usually don't have any stake in the community, they won't necessarily be thinking that way. So he himself, in starting his business, just wanted to improve the community as a whole. What he was saying was that if people in his community got more chances to start their own businesses, then there would be more resources for the community without the harmful effects of gentrification. In addition to surveying people, over the summer I collected data on resources in different Southside neighborhoods. I found that in the neighborhood of Auburn Gresham, there were no large inpatient hospitals. Just for comparison, in Hyde Park, we see that there is one large outpatient hospital, and that is actually the University of Chicago Medical Center. And just for some more comparisons, this is the neighborhood of Lincoln Park. It is a well-resourced neighborhood on the north side of Chicago. As we can see, there are 2 big hospitals nearby where people can go seek medical care. This is an example of how many Southside communities lack extensive medical facilities that serve a wide range of health issues. Having to travel outside of your neighborhood to get medical care can be really inconvenient, especially if that care that you need is really urgent. Now add gentrification into the mix. According to the Centers for Disease Control and Prevention, health disparities are exaggerated in gentrifying communities. That's because more health resources are introduced, but more of the original community residents are pushed out, which means that people in gentrifying communities miss out on getting key health interventions and resources that can improve their health over time. But health isn't just affected by what hospitals are in your neighborhood. There are actually a couple other things that affect your overall health: education, economic stability, environment of a neighborhood, and other social factors all affect what a person's health looks like. And when a neighborhood goes through a dramatic change, like gentrification, this can have huge effects on all of these things, especially these social interactions of the people who are living in a particular community, or I guess the social interactions that they're not having. Since gentrification displaces people, a health risk that's commonly related to it is loneliness. According to the World Health Organization, loneliness can have a huge effect on the mental health, especially mental health of older adults and seniors. Research shows that not having a support system around can lower people's immune systems and have negative physical and mental impacts. For vulnerable populations, like minorities, loneliness could make bad conditions that are already being experienced even worse. Think about this. African Americans are at a 77% higher risk of getting diabetes than white Americans. Black people are also 3 times more likely to die from asthma as white people. And death rates for cancer are much higher for Black people than for white people. Having to go through these health issues alone can only serve to disadvantage African American people in gentrifying communities. As UChicago students, faculty, staff, and Hyde Park residents, we can do something about the loneliness epidemic that's being amplified by gentrification in our own backyards. Each of us has the power to make a meaningful human connection with the local community members that still live here, and with those who have had to move on whenever our paths cross. Take a moment to smile and ask someone how their day was. Share a conversation, make a new friend. Together, we'll tackle the deadliest side effect of gentrification by making sure that no one is lonely ever again.